Good afternoon. Welcome to this Ask the Expert event focused on labor and delivery. Today, a panel of nursing experts will share the information that you want to know about what to expect when giving birth at the family birthplace of Mary Washington or Stafford hospitals. We will also answer your questions live. No question is off limits, so ask away. To submit a question for our panel, simply drop it in the chat here on Facebook. Today's panelists have a ton of experience with childbirth and are absolute experts in their field. These awesome ladies have a lot of letters behind their names. Let's meet them. First, we have Hannah Turner, a registered labor and delivery nurse from Mary Washington Hospital. Hannah has been a nurse for 6 years and with Mary Washington Hospital for 3 years. She holds certifications specializing in obstetrics and electronic fetal monitoring and has a passion for helping women have a safe and positive birthing experience. Hannah is also certified in spinning babies. Hannah also welcomed her first child this year and has found a deeper understanding of the pregnancy, childbirth, and postpartum process. Next, we have Erica Duggins, a registered labor and delivery nurse with Mary Washington Hospital. Erica has been a nurse for 12 years, and 11 of those with our labor and delivery unit. Erica always wanted to be a labor and delivery nurse and considers it an honor to be by a woman's side on one of the best days of her life. Finally, we have Kimberley Good, a registered nurse and the coordinator of parent and child education here at Mary Washington Healthcare. Kimberly is also a certified Lamaze childbirth educator and is an international board certified lactation consultant. Kimberly has been a nurse at Mary Washington Healthcare for 30 years. She's been with the Women's and Children's Program for 24 years. And in addition to her work as our coordinator of parent and child education, she teaches childbirth classes and assists with the lactation program. Welcome, and thanks for joining us this afternoon. Hannah, I'd like you to start the program by telling our viewers a little bit about what to expect when giving birth at the family birthplace at Mary Washington or Stafford hospitals. What makes our services so special?
I can start if you'd like.
Oh, yeah, please.
Perfect. Well, I'm so excited to be with you guys today. I'm so honored to be a part of the Mary Washington organization. And I'm so honored and excited about what we offer here at our family birth centers at both Mary Washington and Stafford Hospital. And I will say, for starters, we have the best staff between our nurses, our doctors, our techs. When you come on our unit, you're going to feel like family. You're going to feel the compassion, the experience that everybody is actually here for you. They want to be by your side. We are honored to be with you on one of the greatest days of your life. So you're really going to feel that when you're on our unit for sure. Now, we have beautiful, spacious rooms equipped with sofas that pull out for beds for your spouse or your support person, because we know how important it is to have people by your side throughout this entire experience. So we really try to accommodate that to the best of our ability. We have rooming in with our newborns. We are considered at Mary Washington and Stafford birthing and bonding hospital. What does that mean? We really value mom and baby being together as much as possible. We know how valuable that time is, especially those first few hours. It's just so important for mom and baby to be bonded. So we really try to limit the baby leaving the room for any reason. Now, with that being said, we do have a nursery. If you've been up all night laboring, by your request, you can send your baby to the nursery if you just need a nap, or if you need a little bit of specialized care, our nursery nurses are available for you to take care of your baby. We also have a level 3 NICU here at Mary Washington and a level 2 NICU over at Stafford Hospital. Now, while we're planning for our baby, we don't necessarily plan for our baby to need the NICU or NICU services. But I'll tell you this, when it comes to delivering your baby, to have them available brings such peace of mind. I know, personally speaking, I had a baby a little over a year ago, and I had an unexpected C-section that was an emergency. And my baby did require NICU services. And as a mama, and I can relate to you, as a mama, to know my son was in the best care possible with the experts in their field, it just brought me such peace of mind. So I love that we're able to offer that at both Mary Washington and Stafford. We also partner with Children's National, which is where we have our pediatric hospitalist and our neonatologist. So as you can see, Ashley, we have so many amazing things to offer at both Mary Washington and at Stafford that make us really unique.
Absolutely. We definitely have some incredible amenities at both hospitals. We did recently hold an Ask the Expert event focused on Stafford Hospital's new Level 2 NICU. So if you're interested, you can check that out on our YouTube channel. Erica, can you tell us a little bit? Preparing for childbirth can be nerve-wracking, especially if it's your first child. What advice can you give to our expecting mamas to be better prepared for birth?
Yeah, that's a great question. Yes, childbirth is extremely nerve-wracking, whether it be your first child or your fifth child, quite honestly. We always hit that moment as moms where we're like, oh, I have to get this baby out. So what I would say when it comes to planning for childbirth is to remain flexible. If you've had more than one child, you know that every birth experience is a little bit different. So a lot of mamas come in here and they have a birth plan, which is great. Preparation brings peace, and we really want to honor any wishes that you have. But that being said, we love when you come in here with an open mindset. Every baby's different, every labor is different, and that's okay. If you come in here with the goal, healthy mommy, healthy baby, you won't be disappointed. We can have these unrealistic expectations sometimes. And sometimes as moms, if we don't meet them, we feel like a failure. We somehow haven't met these unrealistic expectations. So I really advise you, come in here with an open mindset. Healthy mommy, healthy baby for sure. Now, practically speaking, pack your bags, but pack light. We actually have a few things here at the hospital that you just don't need to pack. We have diapers, we have wipes, we have formula, we have feminine products. We have all of those things already here in the hospital. When it comes to packing, things I would suggest would be, your robe, slippers, toiletries that are important to you, a boppy pillow that helps with nursing. So our lactation consultants can help with positioning. Those things are really valuable. And one thing I'll add is a snack bag for dads or your support people. If you have had a baby, dads get hungry, support people get hungry, and it's just nice to have granola bars or trail mixes, Gatorades, things that you can easily grab. Our kitchen isn't open 24 hours a day. And while mamas are on special diets, a lot of times dads and support people are not. So we need them fueled and ready for sure. Practically speaking, though, make sure you remember your insurance card, your photo ID, $12 for your birth certificate. This can be paid for with a personal check or a money order. I will say that kind of gets forgotten. So make sure you're making your list. Drop that down, $12 for the birth certificate. And we also really want you to pre-register online. The last thing you want to be doing when you come in here is, when rip roaring labor, is to stop and have to fill out paperwork. Am I right? So the best thing you can do is pre-register, make that seamless registration process. You can do that by going to mychart.mwhc.com. So make sure you take that time while you're not in any pain and get that taken care of.
Great tips, Erica. Thank you so much for that. Kimberly, Erica talked a little bit about ways to prepare for childbirth. She gave us some great tips, but Mary Washington actually offers several educational classes. Can you share a little bit about the class options and what our viewers can expect when they attend?
Absolutely. Good afternoon. Again, I'm Kimberley Good. I'm the coordinator for parent-child education. I teach all the childbirth classes here. We have a large array of childbirth classes, everything from preparing to childbirth. We have a Getting Ready for Childbirth series that's a 3-night series. It is delivered virtually, so you can stay in the comfort of your own home on your couch. And I like to say, if you have your evening jams on, absolutely great. It's via Teams, and you'll get to connect with me one-on-one. And in the Getting Ready for Childbirth, I'm going to talk to you about labor, the process of labor, how important the support partner role is, and what he or she can do to help you during that labor. But I'm also going to talk about, getting ready to come here to the hospital. We're going to talk about possible medical interventions, but including pain management options, because that's always a number one concern for our laboring moms. How do you guys handle pain? What are my options? So we're going to go through that, but then we're also going to tackle, possible cesarean deliveries, what to expect there. And we are going to talk about the postpartum phase, which is important. That's the 6 to 8 weeks after you give birth, what your body's going to go through. So we want you prepared for that. And in that class, I'm going to also touch base on normal newborn procedures. What do we do here with your baby in preparation of going home? Now, for those parents who are on a strict schedule, we do have a condensed version of that class called the Childbirth Essentials. It too is virtual and it's on a Saturday afternoon. But along with those courses, we have a breastfeeding essentials course. As a lactation consultant here, I definitely am going to encourage you to take the breastfeeding essentials. Even if you're just pondering, do I want to breastfeed? Taking the course as a lactation consultant, I will tell you, our moms come in better prepared, knowing what to expect, knowing what the baby's going to do in those first days and how important it is for us to see that baby latch and positioning the baby. So all of those things, and even pumping. A lot of moms give us questions about when can I start pumping and what happens when I get ready to go back to work, but I want to continue with my breastfeeding journey. So we will talk about that in that class. And then we have another great class called Going Home with Baby. That's just all about taking care of the baby. When do I go to the pediatrician? But what do I look for? What if the baby's sick? We talk about car seat safety. We talk about safety in the home and childproofing and diapering and cord care and giving the baby his or her first bath. All that's covered in the Going Home with Baby class. And I think that Erica and both Hannah will agree, the parents that they have cared for who have taken the classes, these are parents that come in so much more prepared, less anxiety, less stress, because they already have that knowledge base of terminology, what to expect from our labor and delivery nurses. And it just is a much smoother process being prepared taking a class.
Absolutely. Absolutely. So if they want to sign up for these classes, how should they go about doing that?
So if they're interested in learning more about a detailed description about the class, do encourage you to go on to mybabymwhc.com, but then you're going to call HealthLink to register. Some of the classes do have fees associated. So by calling HealthLink, you'll be able to pay for that class. And some of the classes are free. So we definitely encourage you to get pre-registered, but do it well in advance. I will tell you, my classes fill quickly. And so I like to encourage my moms to be enrolled in classes by 28 weeks, not only because the classes fill quickly, but say you do end up delivering early. And I'd hate for you to be 36 weeks and just now signing up. And then the next week, all of a sudden you go into labor and you miss that opportunity to attend class. So, sign up early, be prepared. And being prepared. And I like to say for my parents, moms, dads, the last 4 weeks of this pregnancy, it's just the two of you chilling and just relaxing, having your childbirth classes, being pre-registered, have a pediatrician chosen. You're just kind of enjoying each other, and you know that, hey, now we're ready. We're ready. So.
Absolutely. It's wonderful service that Mary Washington offers, and those classes I can imagine are extremely helpful because then you know what to expect.
Mm-hmm.
If you'd like to call HealthLink and register for those classes, the number is 540-741-1404. Hannah, let's take it over to you. Thank you so much for being here with us today. As Erica mentioned, childbirth, labor, it doesn't always go as planned. Some patients may come in needing an emergency C-section or a planned C-section. Can you tell us some of the reasons a C-section may be necessary, how a patient could prepare for them, and kind of what we can expect?
Yeah, absolutely. It's great to be here today, and I'm glad we get to share some of our knowledge just to help all of these mamas prepare. So some of the reasons that a C-section may be necessary as scheduled would be if you're having multiples. If you're having twins or triplets, our hospitals are prepared to handle those to welcome as many babies as you're carrying. So that would be one reason that you would have a scheduled C-section. Another reason would be that you've had a previous C-section, whether it was emergent or scheduled with the first one. If you've had a C-section before, that may be a case that we would schedule a repeat C-section. And sometimes those babies don't always position themselves correctly. So if you're breech or transverse, then we would recommend that C-section, but that is something that you would talk to your provider about if it was kind of a necessity or not. The other possibility for having a scheduled C-section would be if there was any sort of problem with the placenta or the cord. If there's the risk of a prolapsed cord, or if that placenta is too close to the opening of the cervix that wouldn't let your baby out, if you were laboring, then that would be a reason that we would do a scheduled C-section. For those cases that are unexpected, if you're laboring and then your cervix doesn't dilate, if there's any risk of infection for the baby with prolonged rupture, again, or if that cord is moving into the cervix, that would be the case of an emergency C-section. Probably the most common one that we see for an emergency C-section would be any sort of distress for baby's heart rate. So if there is any sign that baby isn't tolerating labor, or even if you're not in labor and baby's not tolerating any sort of contractions or uterine function that you're having, then we may just recommend that emergency or urgent C-section. In any case, if your delivery does end up being a C-section, we typically recommend that you don't eat anything or drink anything 8 hours prior to the surgery. Again, if that's something that's scheduled, then we have you not eat or drink anything for 8 hours. If it's unexpected, that's why we keep you on clear liquids or what we call NPO, which is nothing by mouth, for part of the time that you're here in labor. So other than not eating or drinking anything, we'll do antiseptic wipes on your belly. We'll do a little shave if you need it, make sure that surgical site is nice and clear. You'll have IV, you'll have labs, all of those things to prepare your body for that surgery and for anesthesia to be able to do what they need to keep you comfortable through the entire process. Your surgeon, which is your OB, will be there with you performing the procedure. If they're unavailable, we do have that 24-hour OB hospitalist that is capable of doing that. So whether your OB is here or somewhere else, we have somebody here 24 hours a day, a physician that specializes in obstetrics, and also anesthesia here 24 hours a day, if in the case of an emergency, you do need that C-section. During the C-section, we typically do a spinal anesthesia, which is just a regional anesthetic. So you'll be awake through the whole procedure. Your support person will be by your side once that anesthesia is placed. So you'll have your support person there with you to be able to take pictures of baby as soon as they're out, and to be part of that to help keep you calm through kind of an unexpected or, unusual circumstance. Another team member in the OR will also be our NICU team and our neonatologists. They're at every delivery that is a C-section, just to make sure that baby transitions from the inside to the outside as easily as possible. Once that NICU team does that initial evaluation of baby, then we have the opportunity to do skin to skin in the operating room and have that initial bonding even before you move into your recovery room. If that's something very important to you, having that skin to skin, or even just being able to hold your baby, even while you're in surgery, we want to make sure that that is an option for you. Again, as long as baby is transitioning to the outside properly. If not, we have that entire support there to make that transition for them. You'll spend about 1 to 2 hours in that recovery area with us in labor and delivery, making sure that your feeling comes back after that anesthesia and making sure things move in the right direction. While you're in recovery, we'll be able to help you breastfeed if that's the plan, or be able to assist you in feeding your baby for the first time while you're still in recovery. The thing to keep in mind is this is major abdominal surgery. We don't take it lightly. It's not something that if there's any other option, we choose to do. So your physician will discuss with you if it's the best choice and if it's the only choice for you to safely deliver your baby. We do have IV pain medicines for you afterwards. And then before you go home, they'll talk to you about switching over to pills that you take at home, whether that's narcotics or just over-the-counter medications like Advil or Tylenol. We encourage you to drink plenty of fluids after delivery and walk as soon as possible. This really helps to decrease the deep vein thrombosis. Since your legs are asleep for a little while, you're not moving and walking. So we put little SCDs on, which is a sequential compression device to help prevent those deep vein thromboses and to get you up and moving sooner rather than later. Also helps to prevent constipation, which after surgery is never a fun thing. We do recommend after delivery and when you're going home, no lifting things more than basically the weight of baby, about 10 pounds for the first few weeks, just to protect that incision. Another way to protect that incision once you go home is to be splinting. Using that pillow to compress on your incision to decrease the stress on all of those sutures that are there. One other point that I wanted to address was when you're taking care of baby after that C-section, to make sure you have that support with all of your friends and community and support person. Because you'll be on those narcotics, because you're recovering from major surgery, we recommend that you don't drive for a few weeks and check in with your doctor if you have any concerns about that incision.
Absolutely. It's so important to rely on your support network. I know as moms, a lot of times we feel like, I got this, I can do this all, I will do this all, but it's very, very important to ask for help when you need it, especially considering a C-section is major abdominal surgery. Erica, I'd like to talk a little bit about pain management. It's a hot topic when we're discussing labor. There's lots of different options and methods available. So can you share a little bit about what options there are?
Yeah, pain is definitely the big question mark when it comes to labor and delivery. Everybody's, nervous, of course. When you come in here, you don't know what to expect, and that's totally normal, and we understand that. But the good news about the pain that comes with labor and delivery is you get a great little prize at the end. So it does make pain a little bit more worth it for sure. Now, there's obviously many options. The two major ones are you can choose to have an unmedicated delivery, or you can choose to have an epidural. Now, we like to support you in both, and you can come in here with one expectation in mind, and you can switch at any point. So if you come in here stating one thing and you choose another, that's great, that's fine. When it comes to our unmedicated deliveries, we have many options to support you. We have peanut balls, we have birthing balls, there's showers in all of our rooms, we have a whirlpool tub. But my favorite thing, because the biggest feedback that we receive from moms who are trying to go unmedicated is being strapped to a bed is the worst thing possible. Being able to move and work through those contractions is so valuable. So we offer telemetry monitoring, which just essentially is our portable monitoring that allows you to ambulate throughout your room or throughout the floor. Because there's sometimes when you're on medications such as Pitocin or other medications that we really want to keep eyes on your baby the whole time. So this is the best of both worlds. We can see your baby the entire time, but you're able to be mobile, which is so important to working through those contractions and meeting that goal of an unmedicated delivery. We are here to support that. We really want to be position changing you if you are in the bed. We really are here to help you in any way meet the goal of an unmedicated delivery. Now, with that being said, if you decide for an epidural, great, that's wonderful. And we have anesthesiologists 24 hours a day at both our Mary Washington and our Stafford hospitals. So if at any point you request an epidural, you can have one. It can be 2 a.m. and we're here. But that being said, one piece of advice that I give all of my moms is to allow about a 45-minute to an hour buffer, depending on where you are in the admission process when it comes to requesting your epidural. There are things that we have to check box along the way to make sure it's safe for you to get this procedure. We have to get labs drawn. We have to get fluids in you. We have to have the anesthesiologist come and see you, make sure you're a great candidate. And then the nurse anesthetist is actually the one that comes up and performs the epidural. So you can imagine that takes some time. So when it comes to requesting your epidural, always kind of keep that buffer in mind. Try not to wait to the last minute when you can't stand it anymore. And as nurses, we're kind of helping you by your side, guiding you when we think it's the best time for you to get that epidural. But keep in mind, when you request it, it doesn't instantly happen. We do have a few check boxes that we need to go through to get you that epidural as safe as possible. Now, the epidural remains on the entire labor and delivery time. We don't turn it off until your baby is here safely and any repair needed is complete. Okay, we're not turning it off. You're not going to run out of medication. We can continually replace those medication CADs that's giving you medicine continually. So don't worry. That's a big thing. Patients come in here and they're like, is it going to run out? No, we can continually replace that. So that's good news. So we don't turn it off until any repairs are complete. At that time, we wait about an hour and a half to 2 hours to make sure your legs are fully functioning. We get you up out of bed, make sure you get to the bathroom, your bladder function is back, and then we head over to our mom baby unit. So we have so many options to support you because, as we said at the beginning, pain is the hot topic of labor and delivery, and we are here to support any goal that you have throughout the whole labor process.
Thank you so much, Erica. It's good to know that, you know, whatever mom chooses to do, the nurses are there to support that and help make that a reality for them. So thank you for sharing that. So we've talked about preparing for childbirth. We've talked a little bit about labor and pain management. Hannah, finally, we've made it through labor. Baby is here. What happens next? What happens in those first initial couple minutes with baby?
Sure. So initially at delivery, we do a screening scoring, which is an APGAR score. Just to determine if baby needs a little bit extra attention or resuscitation right after delivery, again, to make that transition to the outside as smooth as possible. Babies are scored twice, once at 1 minute and once at 5 minutes. This score includes skin color, the heart rate, reflexes, muscle tone, and that effort of breathing. We do 2 points for each, so a max score of 10. I'll say typically most babies get an 8. I've very rarely seen a 10 out of 10. So we're not shooting for perfect score. We're just working them up to it. And again, at 1 minute of life, they're doing a lot of work.
Yeah, absolutely.
You'll stay in labor and delivery for about 2 hours in that recovery in your delivery room, which is also your recovery room, to perform that initial birthing and bonding. Mary Washington strongly encourages that initial time to be skin to skin, to be together. We can delay majority of the things that we need to do until that first hour at least is done. We will dry and stimulate baby initially, and then do delayed cord clamping if that's something that you'd like. Then we'll do dad if he wants to cut the cord, or your support person, or even mom to cut that cord and make you part of that delivery as well. And then we'll do that skin to skin time and do all of our assessments. Can usually be done right there, skin to skin with mom. If you prefer that we dry and stimulate your baby, wrap them up and bring them back over to you as a little baby burrito, we're happy to do that too, whatever you prefer. Majority, again, of those weights and measurements and things like that can be delayed for that first hour. Again, with any procedures, those medications that we typically do at delivery, they can all be delayed until that timing is right for you and your baby.
That's wonderful. I love that. So we're babies on my chest, skin to skin. When is a good time, especially for first moms who've never breastfed before, might not be sure, when do I start? How do I start? When do you first try that first feeding?
So it'll be during that recovery time, but it's whenever baby is interested and whenever mom feels up to it. If you have had a very traumatic delivery and you just need a minute, that's okay. Mm-hmm. Baby can wait. We can supplement if absolutely necessary. If that blood sugar is low or anything like that, if medically indicated, then we can always supplement until you feel up to it. But if you're feeling up to it and that baby looks interested, we'll absolutely help you as soon as you deliver.
Wonderful. Thank you. Kimberly, let's bring it over to you and talk a little bit about the days following birth. The days spent in the hospital after birth can definitely be a blur, especially with sleep deprivation, there's a new family member to care for, lots of new information being thrown your way. So there might be some questions. Can you share some resources that Mary Washington Healthcare has available for new parents?
Oh, absolutely. We have a number of resources for our delivered moms in the community. The first being a moms and babies support group. It meets here every Wednesday up at the John F. Fick Center and meets from basically 10 in the morning to 11:30. It is always attended by not a registered nurse, but she's a certified lactation consultant. So she's there to answer any breastfeeding questions or concerns. There is a scale there that you can weigh your baby, which is a very important process in breastfeeding to make sure your baby is gaining weight. And it's just a great way to get out of the house and just mingle with other moms who've delivered, who are in that same boat with you, and create connections that may last a lifetime. We recently just spoke with a mom who attended the Moms and Babies group many years ago. And actually they're teenagers. And when they were babies in that Moms and Babies group are good friends.
That's amazing.
So that's how long our Moms and Babies support group has been going on, for a long time. And it has been an excellent resource for our community. Now, does that mean you have to have delivered at Mary Washington or Stafford to attend? Absolutely not. This is open to all of our newly delivered moms here in the community. It is free. You do not need to register. Just show up and we will welcome you with warm arms. Other resources available. Now, as a lactation consultant, we definitely have a lactation warm line, which we're going to provide to you. Once you've delivered, you can look, even if you have not delivered with us, please feel free to look up that number. It is 540-741-4465. Get home with that baby, have problems with breastfeeding or concerns. I was just placed on a medication. Is this compatible with breastfeeding? Call our warm line. Our LCs, as we are here 7 days a week, we go back and forth into our office, we check for those messages, and we're going to call you back. But on top of that, in addition to that warm line, if we feel you and the baby need an outpatient consult, we're glad to register you for one. That's where you will come back here, and it is basically a 1.5 to 2 hour visit, one-on-one with just you and your baby, and us helping you figure out what's going on and how can we make your breastfeeding journey better. So that is available to you. Be prepared to, in part of our mother-baby process, postpartum, we're going to do a postpartum depression screening. And if we find that you are a mom that is potential to have postpartum depression down the line or suffer with some perinatal mood disorders, we're going to give you some resources. We do have Snowden available with some counseling, and we're also definitely going to be referring you back to your OB for follow-up, maybe sooner rather than later. And the next best thing that we also have is what we call a HealthLink nurse line. And this is available to you from basically 7 a.m. to midnight, where you can call and ask a nurse for some questions and guidance. And she can answer questions over the phone and then maybe give you references for more community support. And that number is 540-741-1000. Easy to remember. So definitely don't feel like you are left on your own. We are here to provide support even beyond our hospital walls.
Yeah,
that's very true. I personally have called the HealthLink line several times with my newborn, and been like, is this normal? It's a wonderful resource, and especially, the mom and baby support group. People say it takes a village. You need your group, your team, and
Absolutely.
I feel like that can be found at that group if you're looking for that community. So definitely join us at that support group. So now we're going to move over into the Q&A portion of our event today. We've had a couple of questions dropped into the chat, so we'd like to answer some of those. Let's see. We talked a little bit about pain management options. We had a question about that. So how about this one? How many women would you say come in not wanting an epidural and actually make it through without one?
That's a good question. It's hard to put a statistic per se on it. I will say majority of our mamas do get epidurals. We are here to support our unmedicated mamas. But I would say if you come in here, and I will, say that Kim does a great job preparing you to the best of your ability, but sometimes we don't know what contractions feel like until we feel that first one. And
it's true.
And sometimes you're just like, you know what, I'm tired. I find that the moms that are able to do unmedicated delivery is the best is if they go pretty quick, if that makes sense. Sometimes when you're a first-time mama, you're getting induced, it can take time. I always tell my first-time mamas, especially if you're needing to be induced for any number of reasons, to bring your patients, because sometimes it's a process. We're trying to make your body do something that it might not necessarily be ready for. So those mamas, I find that epidurals work better for, because it's just a long drawn out process. Where our moms that come in and labor on their own and they're moving pretty quickly, they're really able to kind of go unmedicated because their body's just naturally progressing them. So it's hard to say a number of, how many achieve this goal versus not. But what I will add, and I will always overemphasize this, if you get an epidural, you have not failed in any way, shape, or form. I think it's really valuable to say that, because for some reason it feels like we get a gold sticker if we have an unmedicated delivery. And that's just not the case. And every labor and delivery, I'm going to reiterate it again, is different. And one baby we might deliver unmedicated, and the next we get an epidural, and the next we get a C-section. That's okay, because you have this beautiful baby at the end. So I will advise my mamas out there, if you have a plan for an unmedicated delivery, great. But if you come in here and you feel those first few contractions and you're like, no way, Jose, it's great. I just cannot stress. I know I mentioned this earlier. I just cannot stress enough, just that open mindset that you're not a failure if you get an epidural.
Absolutely. I feel like flexibility is the name of the game.
It really is.
Your goal is healthy mama, healthy baby, and anything that happens between start and finish, as long as they end in that goal, you've succeeded. You have not failed.
That's true.
Absolutely. This is a good question. So we have a viewer who's getting induced next week. Congratulations, by the way, that's exciting. She was not induced with her first child, so this is going to be her first induction. Can you talk a little bit about what to expect when being induced?
Sure. So when you get here, actually before you get here, we recommend eating. Please eat before you come in for an induction. Mm-hmm. We do want to start the process of getting that baby out once you get here. So we mean business once you get here. So whether that's a Pitocin induction or some sort of cervical ripening the night before, please eat before you come in for your appointment. The other thing that I'll mention before you come in, we are kind of at the whim of babies here. So if you have a scheduled appointment, please call the unit before you come. Your doctor will advise us when you're making the appointment, but just give us a call typically 2 hours before, just to make sure that everything is ready for that scheduled appointment. If you are in labor and things change, that's why we try to have that wiggle room with the scheduled ones. But then once you get here, we'll do all of those things to get ready. We'll start an IV, we'll get your labs, we'll get everything done while everything is calm. We'll talk to you about all the paperwork. We'll talk to you about insurance and all of that process before you start having those contractions and before things get a little bit more heated. And in the moment, we'll try to get all of everything settled and all of your questions answered when you get here about the whole process. But eat before you get here. Highly recommend.
Absolutely. I can second that from my own childbirth experiences. Eat before you go. Otherwise, you're going to be really hungry the whole time. Great. Thank you so much for that, Hannah. We do have a question about the visitation policy, which visitation I know has kind of been with COVID and everything is up and down. So what is the current visitation policy? How many people can be in the room during labor? How many people can be there after? How many people can spend the night? Things like that. Kimberly, do you want to take that one, or Erica?
So yes, I think right now, currently the current visitation policy is you may have up to 4 people in the room in the labor process. Although I think Erica and Hannah probably could add to this. I say that the least amount of people in labor is probably better. I find that birth is a very spiritual, emotional time. Even with getting an epidural, it's just a very private, personal time. And sometimes limiting the amount of people in there can be more calming to you. But if you need those 4 faces of comfort, absolutely. Once you have delivered and you're over on our mother baby unit, then it's pretty much the same policy. We allow 4 people to visit while you are here. Now visitation, does that mean 4 people can stay with me 24/7? No, we do, limit visitation. We try to say, encourage visitors to try to leave usually at least by 10 o'clock, just because our moms need rest, their partners need rest. We do allow one support partner to stay the night with you, and they need to be at least 16 years or older. And the staff will take great care of the support person. There's a sleep sofa in there, and the nurse will provide linens and pillows and things like that. But the other 3 remaining support people should go home, okay? And when you come in, security will stop you, and they're going to ask who they're here to see, and you will receive a specific security badge that you will wear up for that day, and we will kindly monitor the amount of people in the room. Now, siblings are definitely welcome to come now, which is so exciting for us as staff. We'd love to see big brothers and sisters coming to visit. So yes, definitely, we want them to see their new baby brother or sister. So, but they are part of the 4. So just keep that in mind when they come to visit. So, and do know though, that if you feel overwhelmed with visitors, that the nurse is more than glad to, put a nurse sign on your door to see, please see nurse before entering. Because sometimes, our visitors mean well, but they can overstay their welcome a little bit. And then mom's not getting enough sleep, or maybe baby's not being breastfed like they should be because there's just too many visitors. And just talk to your mother baby staff, or even your labor and delivery staff. We're here to kind of be the advocate to make sure you feel like you are getting the proper amount of rest you need.
Absolutely. I think that's a really important connection to make as well, especially if it's your first time breastfeeding. That can be really difficult to learn to do when surrounded by a lot of visitors. So take care of yourself and baby first, and everyone else can visit at a later time. I think Erica maybe mentioned that the jacuzzi, the whirlpool tub, was an option for labor. Can you tell us a little bit about, do we just need to come in and ask like, hey, I'd like to get in a jacuzzi, or is there a process to that?
Yeah, we do have one jacuzzi tub available to you, and it's per like what your situation. It's very situational. If your water has broken, that might not be an option for you anymore. That's provider dependent at that point. If you're needing monitoring, one good thing that I mentioned earlier is that telemetry monitoring does actually work in the water. So we love.
That's cool.
So that's pretty fun. It might not be the best connection. We might be in there adjusting you a few times, but we love that you're able to be monitored while you're in the tub. So that's great. So what I would say is when you first arrive, if that is, a wish of yours, just go ahead and mention it to your nurse, and we can be in, communication with your provider to make sure it's the best fit and safe for you to be in there while you're laboring. We do not deliver in our tub. I will say that. You do need to get back to your room prior. No water births right now. No plans for that. So it's just more for the labor process, but that will be kind of your provider making sure it's safe for you to be in there. But yeah, just make it known that that's a wish of yours, and we'll make it happen to the best of our ability.
Awesome. Yeah, that's an amazing feature to have.
Yeah.
Another question that we had was about lactation. So how many times does a mom see the lactation consultant during her stay?
So I'll speak to that as the lactation consultant on the unit. You actually will see us every day for sure. Sometimes more than once a day. There may be a time that I'm coming in for the first time to my first introduction, and your baby just recently fed or is sleepy and not interested in latching. In your room, you're going to have a whiteboard where the nurse who's caring for you will place her phone number, but you will also have our phone number. We carry phones as we're out on the unit. And what I'm going to advise you is, hey, the next feeding, call me. I want to check that baby's latch. So definitely we're basically unlimited to you while you are with us. It's not just a once and done. And do know that our care is individualized to you, mom. Every mom has a different breastfeeding journey, and it is our goal and our wish to help you succeed in your individualized journey. And so it is personal one-on-one. And so we want you to feel that we are here for you, and we want you to be successful. Breastfeeding is definitely something we advocate for.
Yeah.
Absolutely. That's amazing. Lactation consultants and labor and delivery nurses, angels on earth, I'm convinced. Another question that we had was about food restrictions. So you talked a little bit about how you want to eat before you come if you're being induced, but we might be NPO or on a liquid diet during labor. Are there food restrictions during labor? Does it change whether you're having an epidural or you're an unmedicated birth? Can you tell us a little bit more about that?
Sure. So if you are being induced and you're being induced with Pitocin, once we start that medication or once you get an epidural, we typically keep you on clear liquids or nothing by mouth. Again, depending on how well baby is tolerating that labor process or any of those fluctuations in maternal vital signs. If your blood pressure drops, baby's blood pressure drops, and we may need to do some interventions. All of those things are easier on your body if it doesn't have a full stomach. So we will kind of limit those things. But if you're coming in for cervical ripening, you get breakfast in the morning, you get dinner that night when you get here. We don't want to starve you. We just want to make sure that everything, if there is an emergency situation, that your body is prepared for that. So when you're on Pitocin, typically clear liquids, so you still get ice chips, you still get popsicles, you can still have clear things. If you want to bring your favorite chewing gum, that's a great thing to have to keep you feel like you're chewing on something and that we're not starving you. That being said, we have IV fluids. You are staying hydrated, even if you're not eating anything. And again, that's to protect your body and to protect baby. Dad has the opportunity, or your support person will get a guest tray. So again, we're not going to starve them while you're here in labor, even if you're on clear liquids or not able to eat anything. We will still feed your support person as well. But yeah, typically once we're doing that Pitocin, if we are doing any sort of induction or augmentation with your labor, we'll keep you on clear liquids. If you're laboring naturally, talk to your provider. Sometimes they're a little bit more lenient if you're laboring naturally. But once those contractions really hit, most mamas aren't really interested in eating.
Not interested at that point. I can imagine. Thank you so much for that, Hannah. That's great to know. Can you talk to us, Erica or Hannah, a little bit about the postpartum care and supplies that are provided? We had a question about whether a peri bottle is supplied within the hospital or should we bring one ourselves. You talked a little bit more about the equipment.
Yeah, well, we definitely start with that peri bottle right at labor and delivery. So hold on to that thing. So we can give you as many as possible, but you do have one right from the very get-go. Once you deliver, we highly encourage you using that every time you use the restroom or, change out your feminine products every time. So that is provided for you. We also give you like a dermaplast, which is like a numbing cooling spray. So if you've had any type of repair, it's nice to spray that every now and then. We send you with a supply of pads and those goodies, teach you how to make a great ice pack. Our mom baby nurses are experts at the diaper ice packs that every woman is like, yes. But we do provide you with those things. So don't worry about bringing a peri bottle. We also provide, if you need to, some sitz baths over on mother baby. If you have, a repair that's bothering you, they'll teach you and educate you on sitz baths, how to do them at the hospital, and then once you get home. So lots of education and lots of tools put in your hand to make sure that you're equipped. And as Kim said, we really don't leave you hanging. So it's not like you get home and we're like, okay, bye. We have so many tools and resources that we have the health link nurses and lactation, and we can answer questions once we get home. And if we don't provide you with those supplies, we can definitely tell you the ones that we recommend.
Absolutely. Thank you. Another question was about if they could bring their own labor gown, which I assume.
Yes.
You want to be cute and match the baby.
Yes, I will say we love those labor gowns, but when you're shopping on Amazon or wherever, make sure it opens in the back. Because if you do choose to have an epidural, I know that's silly, but make sure it opens in the back because we have these really cute ones that we end up having to take off if it doesn't open in the back. So make sure when you're doing your shopping, it does that.
Great point. Great point. Is there a freezer available? There's a lot of recommendation to make like padsicles where you put and freeze it. Is there a freezer available to store those?
Yes, we have a freezer available that anything that you need, we have a refrigerator actually on our unit and a freezer that we just label it. We don't normally, do our pads in our food freezer, but we can accommodate what you'd like for sure.
Great.
I was just going to mention, save your supplies and those homemade padsicles for at home. We have those supplies here. So if there's something that you particularly want to make you feel extra comfortable after delivery, absolutely bring them, but don't feel obligated to bring those supplies because we do have those. Use our supplies while you're here. And then when you get home, use all your homemade stuff.
Yeah,
Absolutely.
That's a good point.
Great point. Take all those goodies home with you, all the good stuff.
Package.
We spoke a little bit earlier when talking about like unmedicated birth for the different laboring positions. We have a question about whether the beds have a bar for a squatting position.
Yes, we absolutely do. We actually have multiple squat bars that can be attached into our labor beds if that position does feel best for you for pushing or for laboring, along with those birth balls and the peanut balls like Erica had mentioned before.
Yeah, that's amazing. I remember being very surprised that bed is like a transformer. It can go lots of different ways. Which is super helpful when you're, positioning everything. Thank you.
Yeah.
Hannah, I want to also ask you, so Mary Washington Hospital is a safe sleep certified hospital. And, we talk a lot about keeping baby safe in the crib or the bed at home and preventing SIDS. Can you share a little bit about ways to prevent SIDS and ways to have a safe sleep?
Yeah, absolutely. So with the American Academy of Pediatrics, they have the ABCs, which is alone, on their back, in their crib. So baby should be alone on a firm surface. That sleeping surface should not be shared. So if they're in your bed, having that separate like duck type of thing, making sure that's firm and separate from where you're sleeping. Because if you roll and baby rolls in, we just don't want any accidents to happen. And then sleeping on their back. It's been studied. It shows that being on their back does decrease that risk of SIDS every time. Nap time, not sleeping on you, sleeping on their back in that safe spot, safe place, and keeping their head and their face uncovered. So no hats while they're napping, and making sure that there's nothing that could go over baby's face while they're in their crib. So no blankets, no bumpers, that wearable blanket. We actually provide a halo sleep sack while you're here at Mary Washington. That gives them that protection, that swaddle that can't go up over their face while they're sleeping. We do also provide information about the Safe Sleep program and informing parents on not smoking around their baby, not drinking or doing any drugs while they're caring for baby, and not using any positioners or wedges to assist in positioning with sleeping, and then to consider a pacifier. Studies are now showing that having a pacifier can decrease that risk of SIDS, but never taping it to a baby's face, never propping it to hold it in, never forcing a baby to have that pacifier, just letting them take it as they please.
Mm-hmm.
Yeah, that's a great point. Those are great tips. Thank you. Kimberly, we've talked a little bit about ways to prepare for childbirth. What can I do prior to my delivery to prepare for actually bringing my baby home? Do you have any tips for us?
Well, as the childbirth educator, my first number one tip is register for a childbirth class. Get prepared for that baby, okay? Because I definitely want the opportunity and the privilege of teaching you. But a couple other things that are really good in preparing. Get a pediatrician chosen, okay? You want to reach out to local pediatricians, find out, will they be accepting new patients at the time of your delivery? And if so, I'm going to be calling you actually from the hospital. Because the baby will need to see his or her own pediatrician by day 1 or day 2 after leaving the hospital. So you need to know who that baby is going to see, who's going to resume their care. Now, they will be seen here by a pediatric hospitalist every day while they're here. But that pediatric hospitalist is a pediatric specialist who remains within our 4 walls. They don't go home with you. So you need to have a pediatrician once the baby goes home. Now, no worries, everything that has occurred with the baby is faxed to the baby's pediatrician so that they can resume and they can look over what's happened here in the hospital. And the next thing I'm going to tell you to get ready to do is to childproof your home. You know, they don't stay that little for long. And believe it or not, in the blink of an eye, we're up and we're toddling and we're trying to crawl and we're looking at what we can get into. And that's how they explore their environment and that's how they learn. So we want to look around our homes and we want to look for unsafe situations like, you know, extra cords and furniture that could potentially be, if I climb up it, am I going to topple it over? Where are my cleaners stored at? You know, all things that babies could potentially put in their mouth, strangle, things like that. So we want to get that home ready. The other thing I'm going to encourage you to do, if you intend to be a breastfeeding mom, this is the time now to contact your health insurance and find out what type of a breast pump they offer, and find out, can I get that breast pump in hands before I deliver? Because if the night you go home, you happen to go into engorgement, which is mature milk coming in, sometimes babies have a little difficulty with latching with engorgement. Well, knowing that you have that pump at the house, you know how to set it up, makes life a lot easier. So this is the time now, reach out to them, find out, you know, what pumps do you provide and can I go ahead and get my pump? Number one thing, another thing to think about, make sure you get your car seat safely installed. Look on our website, we have a relationship with the Fredericksburg Police Department who will assist in that. It is free of charge, but I will tell you it's a 45-minute visit, but it's amazing because they are going to show you how to install that car seat in your car specific to your make and model. And knowing that, hey, I know my car seat's installed, I know how to install it, this is precious cargo now. And so we want to make sure that from here on out, the baby's traveling safely in your vehicle. Our nurses are not allowed to do a car seat check for you. We're not allowed to place the car seat in the car. It requires certification that we don't have. So we want you to do that ahead of time and be prepared for that. So those are some helpful things just to, you know, start preparing, start thinking and being prepared. I'm ready to bring this baby home. I've done all these things.
Absolutely. Thank you. Well, we're nearing the end of our time. I know we have a lot of questions still in the chat. So we'll be answering those questions to you directly via chat. But I do want to thank you guys so much for sharing your time and your expertise with us. I know labor and delivery can be overwhelming. So we're really hoping that the resources that we've shared today has been helpful on this really exciting journey to parenthood for our viewers. Thank you so much for tuning in. If you have questions about labor and delivery or you want to learn more about our services, we invite you to visit our website for additional resources. That is mybaby.mwhc.com. Be sure to watch the Mary Washington Healthcare Facebook page and other social media channels to stay informed of the latest health and wellness information for our community. Again, thank you so much for joining us today. Please stay safe and healthy and have a great afternoon.